Hi, this is Dr. Tim Moser. Welcome back to Med Rounds. Today's discussion is shingles. Now, shingles can be known by other names. Zoster, herpes zoster, shingles all refer to a condition that can affect people after being infected with the chickenpox virus. Complications of shingles can include a lifetime of pain or possibly blindness. Now, anyone who has been infected with the chickenpox virus can later on get shingles. The chickenpox virus belongs to a family of viruses called the herpes viruses. Once a person is infected with one of the herpes viruses, you kind of are stuck with that virus for life, and here's why. When infected with a herpes virus, including the chickenpox virus, during the active part of the infection, the virus finds its way to your nervous system. Once in the nervous system, it goes to the part of the nerve cells where your DNA is located. Your nerve DNA is actually split open and the virus inserts itself into the nerve's DNA. There is no way to remove this DNA once it's been inserted. So once you have been infected with the chickenpox virus, you carry the chickenpox DNA with you forever. Later on in life, if this virus should become reactivated, it will follow the infected nerve cell out to the skin and cause a rash. Kind of an interesting side note, that rash actually contains chickenpox virus. So those suffering from shingles could give somebody chickenpox if they've never been infected with chickenpox before. So shingles may occur many years or many decades after a person had chickenpox. The symptoms of shingles usually always involves pain. Now, this pain may appear several days before the person notices the rash. The rash itself always consists of what looks like little water blisters. These are often confused, especially in the early stages, with bug bites. A shingles rash has been described as dewdrops on a rose petal, meaning you have the small water blisters surrounded by an area of red skin. In its early stages, it may be a small round patch on the skin, but later on, an entire portion of the body on one side may be affected. Now, as the nerve travels from the spinal cord, it comes around towards the front of the body and ends in the midline. One nerve usually supplies an area of the skin that's several inches wide, and we call this area of skin a dermatome. So shingles affects people in a dermatome fashion. It is usually on one side of the body and one nerve is affected. Treatment of shingles is pretty straightforward. If treated within 72 hours of the start of the rash, strong antiviral medication can be given. This stops the virus from replicating in that nerve dead in its tracks, and it can stop the shingles from progressing. Now, this is important because if left untreated, the shingles can actually cause nerve damage. Nerves heal very slowly, so even after the rash from shingles is gone, the nerve damage can remain. The result of this is a strong, lancing type of pain that can occur intermittently throughout the day and through the night, and that can last for many months, and if you're unlucky, can last for life. Another potentially serious complication of shingles is if it happens to affect your eyes. Now, you can get shingles on your face, and if you have the nerve affected on your face that comes across your eye in this area, then the cornea of your eye can be affected. This can lead to scarring of the cornea and blindness. So it's very important that if you're experiencing a shingles outbreak and it's up near your eye, that you see an eye care provider so that they can examine your cornea and make sure that it's not being infected. If it is infected, then eye drops can be given that will stop the infection and spare your cornea and perhaps spare you from having blindness later in life. Prevention of shingles can be accomplished by the shingles vaccine. Now, this is recommended for those that are age 65 and older. It's a single vaccination, and what it does is it boosts your body's immunity against that chickenpox virus that you're probably harboring in the DNA of your nerve cells. The shingles vaccine is kind of a souped up or a very strong version of the very same vaccine given young children at 1 year of age to help them prevent getting chickenpox in the first place. This has been Dr. Tim Moser with MedRounds, wishing you the best in health and prosperity. Until we meet again, take care.